Medicare's annual enrollment period is coming, and 2026 is one of the biggest years yet. Here's what you can't afford to miss. So first and foremost, what is AEP? So AEP, it goes from October 15th to December 7th. And essentially what it is your opportunity that you have once a year to explore new plan options. You could switch from one Medicare Advantage plan to another. You can join, switch, or drop a Part D prescription drug plan. And you could change from original Medicare, so Parts A and B, your red, white, and blue Medicare card, to a Medicare Advantage plan. You can do this. There are Medicare Advantage plans that have prescription drug coverage, and there are some that don't have prescription drug coverage if for some reason you're interested in a plan that doesn't cover prescriptions. And you can change back from you could change back from Medicare Advantage to original Medicare, or you could switch from a Medigap plan to a Medicare Advantage plan. There are other times throughout the year that you could switch between Medigap plans if you can pass medical underwriting, but you can't go in, let's say June as an example, unless there's certain circumstances that apply to you. You can't necessarily just go anytime from the year from a Medigap plan to a Medicare Advantage plan. So you really need to look at that during AEP. So again, it's October 15th through December 7th. All right, so why did I say that 2026, it's really important? First and foremost, Part B premium is rising in 2026. Generally, what we see is when there's a Social Security cost of living increase, there is a Part B premium increase. So it's anticipated to be $206.50, that Part B premium for next year. As you may know, higher earners will pay more for their Part B premium. The Part B deductible increases. Again, these are estimated. A lot of reputable sources believe that these will be the numbers. So I've seen a lot of people committing to them, but just be aware that it's not 100% finalized. But that Part B deductible is $615 is the estimated. And the Part D out-of-pocket cap. So this is, as a reminder, starting in 2025, there was a $2,000 max out-of-pocket on the Part D drug plans. For next year, that increases to $2,100, and that is set. Medicare Advantage premiums, copays, and maximum out-of-pockets vary by plans. Check your ANOC that you should have received in the mail. We have other videos on this. Check that. You normally get that in September, so you should be hitting the mailboxes relatively soon. So, we've seen a lot of the plans eliminating some benefits, changing the dollars that you'd pay for certain things. Just be aware of how your plan is changing. And, one thing to mention is I have mentioned the Social Security cost of living adjustment, the COLA, and I've mentioned the higher earners. Some folks, if you are a higher earner, the Social Security COLA for 2026 may not fully offset the increase in Medicare costs for some. For the vast majority, if you're paying, the Part B $206.50, it should offset there. But, everything's costing more these days. So what should you do? I'd really recommend that, if your costs are getting sort of uncontrollable, that you compare a Medicare Advantage versus a Medigap or Medicare Supplement and a Part D drug plan. Just know what your options are. Review your prescription drug coverage changes, the formularies, the tiers, etc. Make sure if your premium's changing. I've heard some of the premiums are changing on some of the plans. Check your provider networks. Are doctors still covered? This is a big one for 2026. There's a few different hospital systems and insurance companies that are sort of at odds right now when it comes to networks for 2026. So just really be aware to make sure that the doctors or hospitals that are most important to you are still in the network for you. Evaluate extra benefits. Dental, vision, over-the-counter, etc. I've seen, it really seems like as some of these other benefits that we've seen them add the last few years, things like groceries, over-the-counter, as those start to reduce, we still have, the good news is we're seeing dental and vision still strong benefits for most individuals. And if you like your plan and it's still offered, it renews automatically. So you don't necessarily have to do anything, but I would recommend you at least check out your options to make sure that if you like your plan and it's still here for next year, just make sure that it still works for you.